I am pleased to bring Martin Arrick to the symposium today. Martin is Managing Director at Standard & Poor's, which is a bond rating agency. And he's been there for about 25 years, and I've known him for about 20. He is probably the most highly regarded analyst within the not-for-profit healthcare space. And given all of the changes that we are dealing with within our sector, and the fact that the lines are now all blurred between the for-profits, the not-for-profits, and the insurers, and a lot of the new entrants that Jonathan alluded to, Martin is going to take a few minutes to talk about some of the challenges that we are facing from the provider side in terms of adapting to the new models of care that maybe will help tie in with some of the other discussions that are taking place today. So it's my pleasure to introduce Martin Arrick.
Thank you. Well, thanks everybody. I've been here since late yesterday, and I've been listening to a lot of the presentations. And the first thing that comes to me is I'm like, why have they asked me to talk today? It's not entirely clear. Deborah said I'm a bond analyst, and what I do for a living all year long is I go around and I talk to chief financial officers at hospitals and health systems. And of course, I'm sort of the numbers guy, but it's much more than that. We spend a lot of time talking with everybody on the leadership team at hospitals and health systems, and we spend a lot of time talking about the strategy that organizations are thinking of, what they're doing, and of course, that's very future-oriented, and that's where everybody at this conference comes in, because you're helping to direct the future of healthcare, and of course, you're trying to get in and talk to the folks that are running the hospitals, because I would argue they're still at the center of what goes on. And if you think about physician acquisitions and how hospitals are employing more and more physicians, you quickly get to think that, well, if the doctor is the center of healthcare, and of course they are increasingly employees of hospitals. So of course you have to talk to the hospitals and the health systems. So having said that, I think that in some way is kind of why I'm here, but I'm also here to talk about what is going on today and what are the problems that hospitals have on their plate today as they think about the future. So here's the agenda for today. We want to talk a little bit about reform, the current healthcare environment, what the outlook is, and kind of just what's going on in the environment today. So let's talk a little bit about reform. Obviously, the bending of the cost curve that the ACA is so behind has in fact begun to happen. Is it sustainable is of course an important conversation for our country as a whole and everybody in the room. But I can tell you that the people running hospitals and health systems are acutely aware of this, and they are leading the charge on trying to control costs. Some of the things they're dealing with, obviously, are value-based pricing. We hear about that all the time. I heard about it at this conference, of course. But it's still relatively small. It's all about trying to prepare for the future, but those days aren't here yet. They're still fairly small. Same thing with price transparency. There's a lot of discussion about price transparency, and I think it's going to be an important driver of business growth, an important driver for everybody in the room over time. But to date, the people who are low-cost providers, they come and they talk to me and they say, Martin, we're not getting enough business. I don't know why the fact that we're the low-cost provider isn't driving enough business to us. So it's a fairly complicated environment that we're in. And obviously, we're seeing a lot more having to do with risk and risk-based pricing and hospitals taking on more risk. I'm sure the folks in this room in Boston Look at Partners and say they just last year, the year before, they bought the neighborhood health plan. What's that about? Why does Partners want the neighborhood health plan? They want to get into the risk business. They want to understand how risk works. They need to feel that they are sharing in risk and the benefits that doing a good job in risk will bring them. So these are some of the things. There are a few other bullet points, but just to give you a flavor. Now, healthcare reform is a bigger topic than simply the Affordable Care Act. The Affordable Care Act is a subset of healthcare reform. And we happen to think that healthcare reform will continue forward no matter what happens with the Affordable Care Act. And of course, I'm hoping that the Affordable Care Act continues, but there is certainly a political component of it that I think we're all aware of. Since the ACA became law, the actual credit impacts on the organizations that we work with has been fairly modest to date. It hasn't been the big negative that a lot of the critics think it will be. And in fact, I think it's been a real positive for individuals, for people who now have insurance who never had insurance. And if you think about Medicaid expansion, which is so much in the news this year, because this is the first big year for Medicaid expansion, we have some early evidence that it's helping hospitals, and of course it's helping the people who have insurance. Over time, okay, people are really worried about what the exchanges are going to do to reimbursement. And that's one of the themes that we're talking about here, is not only do people have to cut costs, but the big driver is the amount of money going to hospitals and health systems is declining over time. And the exchange is a part of that. Compared to commercial insurance, exchanges are probably going to reimburse hospitals, health systems, everybody at a slightly lower rate than sort of the best payers. And that's a concern over time. So one of the big issues and one of the big promises of the ACA is we want to get to sort of a more population health management state. And we want to do a better job taking care of people, and we want our healthcare system to keep people healthy. We don't want to just treat them when they're sick. Seems obvious. And I would argue that a lot of the senior leadership in hospitals and health systems see that that's where the system is going. The big question, obviously, is how do you get from here to there? And of course, the folks in the room and the companies you represent are trying to do precisely that. But I can tell you hospitals tend to be very conservative organizations, and they don't want to hurt their overall financial performance while they're getting from here to there, even though they see the need to get from here to there. Some of the fellows at the fireside chat last night said, it's all about baby steps. And I would argue that a lot of the baby steps have to do with financially getting from here to there. You can't blow up your organization while you're doing a better job. This is probably something that everybody has seen in one way or another. The kind of amber bars are the percentage of employer-based insurance in this country. For a long period of time, the number of employer-based insurees has declined. Employer-based insurance is the gold standard. Everybody wants commercial coverage, but it's declining over time. This is a fundamental trend. Then if you look at employer-based coverage, look at the growth in high deductible plans. Obviously, 15, 16 million is still a relatively small number in a country as big as ours, but that number keeps growing, and it's growing exponentially. And that number, high deductible plans, I think we're all aware that the next step after high deductible plans is probably private exchanges. It all fits in. And all of that is going to really put a lot more on the average person, pay more, be more responsible for their health care, but it's going to put a lot more pressure on hospitals. and health systems. These are fundamental trends that the system's going through, and these are trends that have financial management and general management very concerned. We see the pressure continuing. Right now, our outlook on the sector is negative. Generally, 1 to 2 years is what our outlook period is. We mentioned the kind of fraying of the employer-sponsored health insurance base. If you look at Medicare and look at what the ACA has done to Medicare, in a number of different ways, it's basically reduced the rate of growth of Medicare expenditures. Federal reimbursement policy, also part of ACA, value-based purchasing. I think people would argue that value-based purchasing is a good thing. It's the thin end of the wedge to get hospitals to think about keeping people healthy. We don't want to pay for readmissions. We want to do a better job getting hospitals to change their focus. The percentages are still fairly small, but the direction is clear. Commercial plans doing pay for performance, also beginning to move to value-based contract. All of these forces are reducing the rate of growth that hospitals are seeing in their revenues. And hospitals are responding. I mean, I love the damaged care show that we saw about an hour and a half ago. I mean, loved it. But there's some fundamental truths about dollars that I think we can laugh at, and it's kind of funny. And they had a lot of things to say that were really fairly pointed and, of course, true. But it's also true that healthcare is rising. The expenditures for healthcare are going up faster than our country can afford. And where the rubber meets the road is hospitals and health systems, because that's still where the vast majority of the dollars are spent. So hospitals, the last few years, have cut costs with a vengeance. They've maintained some of their profitability, not all of it, and they've managed to go through. I think hospitals tend to be very resilient organizations. But one of the things that's happened over the last year or two that's really proved to be very difficult is all of a sudden utilization has started declining. And I would probably argue that that's a good thing if you're a patient. You have fewer admissions. Hospitals have spent a lot of time working on quality. They're doing a better job on quality. They're keeping people out of the hospital. Length of stays are down. Value-based purchasing is keeping people out of the hospital. Higher copays and deductibles from those high deductible plans are causing people to postpone elective surgeries. All very positive things that are happening, and yet hospitals can't keep up. Their dollars are slimming down. And that's why they're cutting costs, and that's why it's important for them to cut costs. And they're also seeing competition from lots of different places. And at this point, the level of competition is still fairly small, but it's rising quickly. And some of that competition is going to be from the kinds of products that you folks are putting out. And I guess I'd say to you is you need to recognize that to the extent that some of these things are successful, it is running right into the hospital business model. And so how do you try and get out there and get hospitals to work with you and incorporate the technology? And obviously, it ends up being how do we continue to push value-based initiatives? So in the interest of time, we talked a little bit about the declining utilization, so we can keep going. We're also seeing a lot of consolidation in the sector. You might say, well, why is this happening now? Obviously, it's financial in nature. Some of the benefits of consolidation is scale, negotiating with the insurers, size, scale, geographic reach. And I think if you think of the 90s, take Partners as an example, they pulled their system together in the mid-90s. And that's really what it was all about. Scale, efficiency, better negotiations with the payers. But fast forward 10 to 15 years, and where are we now? Well, those things about consolidation still hold. People are trying to go for the next generation of cost cutting. How do you do that? You can't cut one more nurse. You have to start systematizing across multiple organizations. You have one HR department, one legal department, one finance shop. We're seeing that. We're beginning to see service line consolidations, although that still is very rare. People want services in their own communities, and people are very reluctant to go down that path, but I think the finances will ultimately drive that way, and the quality of care will ultimately drive that way. So we're seeing consolidation now also for managed care, kind of population health management. You know, if you want to do population health management, you have to cover the whole region. And that's really hard to do unless you have the right geography. So mergers and acquisitions are expected to continue, probably for somewhat broader reasons than they have historically. Some of the recent trends we're seeing, and this may be a little too in the weeds, it's very finance oriented. You know, we rate about 500 hospitals and health systems. I know I am here as one member of a group of 15 people that work across the country. We're definitely seeing the operating margins that hospitals have decline. And they're very worried about that, obviously. Again, we can joke about it as damaged care did, and it's important, but there is a reality there that we need to kind of keep in mind. Now, a lot of hospitals have built up their balance sheets over the years. Unrestricted cash and investments, endowments, you know, think universities in the role that endowments play in universities. A lot of the big health systems are trying to build up their balance sheets, so that provides a cushion in difficult financial times. And they have a long way to go to equal the universities. They're great universities in this country. But it does also highlight an additional risk is, you know, if you're living by investment income, you are subject to the ups and downs of the market. And that in and of itself is its own risk that needs to be guarded against, which is why people are so focused on operating performance and basically, can you stay afloat in your core business, which is hospitals and health systems. Our expectation is the weakness is likely to continue for a while. And if you look at our outlooks, this is sort of maybe an easy depiction. About 8% has been relatively stable. 8% of the organizations we work with, we think, have a positive outlook and are likely to see their rating raised over the next 1 to 2 years. But the number with a negative outlook is, of course, accelerating. And that's for a lot of the reasons that I'm talking about today. So these maybe just in summary, some of the reasons why we're tending to be negative right now on the sector. One of the things is, I'd maybe just highlight here is risk-sharing arrangements. It's fine to see hospitals trying to get into risk-sharing arrangements, and if they do a great job, that's going to be great. They're going to benefit. But what if they don't get it right and they do a bad job? We're going to see a lot of negative news come out if they haven't got the risk parameters just right. And a lot of these hospitals, they're in the healthcare business, they're not in the insurance business. So again, there's this risk there over time. There are a lot of positives as well. People do have strong balance sheets, and that's a real strength. There's a lot of time and energy being focused on new business models, trying to develop population health management, trying to expand overall system size and scale. All of these things are very helpful. The feds have come up with a lot of money for IT. The Medicaid expansion, I think, will ultimately turn out to be a real positive, although I think some of the details are still pending on that. It's still a little bit too soon to say. And there have been a lot of provider fee programs in a lot of states where the government has come in with special funds to help out. And I guess I'll just leave you the last few things here. There's a couple of key uncertainties in the sector. One is, can folks manage risk successfully? It seems clear that hospitals and health systems have to get into the risk business, and getting into it and managing it successfully are two different things. Over time, there's going to be a lot of pressure both on the use rates that people go to the hospital. We think over a long period of time, use rates will continue to come down. How far down is not clear. Number of patients in beds is likely to decline. And you can think about what that means for the healthcare system, even though it might be good for patients. New technology, I guess that's why we're here. We're hearing a lot about it. I have the sense from some of the folks yesterday who were talking about the availability of money and how hard it is to get. You have to really look at the kind of assumptions you're making in terms of how quickly there will be an uptake. And I think you have to very much think about what you do and how will it impact hospitals and health systems. And if what you're doing is going to make life a lot harder for them, I think that's something you have to really think about, and how will you manage that successfully as you go about your business. And lastly, the nature of competition amongst hospitals themselves is changing. Who hospitals are competing with is changing. And these are big questions that we all need to be thinking of. So I really appreciate your time, and I guess the one last thing I'd say is I think hospitals and health systems have been resilient over time, and I think you have to think about how they respond as you come in with your changing businesses and ways to change how they do business. So thank you very much.